There are several methods to multimodal remedy for patients, from medical trials to traditional processes, and the entirety in between. Treatment orders and options are quality determined on by way of specialists, based totally on affected person health, the level of cancer and other critical factors. Multimodal therapy entails the usage of numerous treatments to lower the mesothelioma cancer cells, forestall the spread of these cells, or improve existence expectancy for patients. At the same time as there are several factors worried in selecting the order of remedy, speak along with your specialist about treatment options or scientific trials, is the great manner to decide the proper approach for you. Multimodal remedy makes a specialty of disposing of cancerous tumors, with several remedies for top-rate consequences. Multimodal therapy is adapted to each affected person's particular case. The most used multimodal remedy approaches are radiation and chemotherapy. This is administered earlier than, during, or after surgical operation, at the same time as multimodal processes and treatments may be noticeably effective. They are now not constantly the high-quality alternative depending at the after surgical operation. At the same time as multimodal processes and treatments may be noticeably effective, they are now not constantly the high-quality alternative depending at the remedy is the first-rate option. Mesothelioma multimodal strategies. There are two fundamental techniques to multimodal remedies for mesothelioma patients, and neoadjuvant remedies are similar, however vary based totally on the order of use at some point of treatment. Adjuvant remedy, used frequently after surgery. The adjuvant remedy is taken into consideration additional remedy to minimize the risk of most cancers returning. At the same time as surgical procedure, eliminates as a great deal of seen cancer cells as possible. Microscopic bits may additionally remain undetected, and additional treatments might also prevent any returning cell increase. Treatment options for adjuvant remedy can also consist of chemotherapy, anti-most cancer capsules that input the entire frame into the bloodstream to kill most cancers orally or through veins. Radiation remedy, excessive powered power beams, like X-rays, that input the frame internally or externally to kill most cancer cells. Adjuvant radiation therapy targets the region around the unique most cancer's location to reduce the threat of recurrent growth. Immunotherapy, a technique of running with the frame's immune system to fight off the last cancer cells via stimulating or supplementing the frame's defenses. Targeted remedy, used to adjust precise abnormalities in certain most cancer cells to goal the unique features, and use focused remedy pills to work on eliminating those cells. Hormone remedy, evaluation of cancerous cells. Every so often reveals a sensitivity to hormones. Remedies to forestall the hormone manufacturing or block the effect of the hormone can be beneficial. Adjuvant therapy is not beneficial to all patients, and the potential aspect consequences of those treatments can be severe for some patients. Please seek advice from your health practitioner approximately those factors while discussing treatment options. Neoadjuvant therapy. Adjuvant therapy used earlier than the primary treatment of mesothelioma is known as a neoadjuvant remedy, and is used often to make radiation or surgical procedure greater effective and less complicated. Given as a primary step in treatment, typically before surgical treatment. This works to reduce tumors as a form of initial care, induction therapy. Remedy alternatives for neoadjuvant remedy might also consist of chemotherapy, anti-most cancer tablets that input the complete frame through the bloodstream to kill cancer orally or by means of the vein. Radiation remedy, high-powered energy beams, like X-rays, that input the frame internally or externally to kill cancer cells. Adjuvant radiation therapy objectives: the region around the authentic cancer location to lessen the chance of a recurrent increase. Hormone remedy, evaluation of cancerous cells from time to time, famous sensitivity to hormones. Treatments to forestall the hormone production or block the effect of the hormone can be beneficial. Neoadjuvant remedy isn't always beneficial to all patients, and the capability facet effects of these remedies can be extreme for a few sufferers. So please seek advice from your medical doctor about those factors when discussing treatment alternatives. Kinds of multimodal remedy. There are exceptional varieties of multimodal therapy combinations, verified to most successfully treat sorts of mesothelioma. Many multimodal treatment plans started as unconventional approaches, however, are now being recognized for their innovativeness in targeting and treating mesothelioma. SMART. SMART is the technique of the use of multimodal remedies to influence the life expectancy of mesothelioma sufferers, but using a way that switches around the order of treatments to enhance effects. SMART is a two-step technique that includes intensity modulated radiation remedy, IMRT. Patients are given a high dose of IMRT, which administers simultaneous tiers of radiation through the vicinity. Radiation degrees are higher than regular treatments, and are made feasible simplest due to the fact the irradiated lung is eliminated shortly after the remedy, EPP. Extrapleural pneumonectomy, EPP. Approximately 6 days after an affected person is given IMRT, the affected lung and surrounding tissue are removed. Further studies are being conducted to attempt to store the lung for patients in the future. Tumor. At the same time as the alternative mesothelioma cells are killed, at some stage in the chest hollow space. Being capable of providing higher doses of radiation than casting off the lung has extended outcomes, due to the fact the chances of the radiation or cancerous cells transferring through the body are deliberately restricted. Every other factor is that giving radiation earlier than a surgical operation is less difficult for sufferers to get over than giving radiation before a surgical procedure. Intraoperative chemotherapy and radiation. Delivering irradiation. Intraoperative radiation or chemotherapy. Intraoperative chemotherapy capsules in the course of surgical treatment is frequently used to improve management of the area of the tumor at some point of operations. Frequently, this dose of radiation or chemotherapy is restricted through the presence of wholesome tissue in an identical place. Multimodal therapy survival rates. Survival fees are used as an approximation of lifestyle's expectancy for patients with a similar analysis survive. That information range is based totally on a selection of factors that include age, gender, stage of the most cancers, cell type and histology, treatment alternatives. Survival costs for plenty of sufferers can differ from the initial analysis due to numerous elements or misinterpretations. Now and again they range irrespective of remedy or because of the approach of remedy. As people are unique, survival costs also can be unique and have to handiest be used as a guideline. Talk to your doctor approximately survival rate information and issues you could have, as those vary because of the elements indexed above and any potential breakthroughs in cutting-edge research. Multimodal remedies with new remedies. Medical trials are a huge source of development for brand spanking new remedies and procedures for sufferers that do not have the choice of traditional treatment plans or remedies. If the cancer is just too superior, a clinical trial and a mixture of different remedies may be the best hazard to increase existence expectancy or enhance fin of life. Speak in your medical doctor's approximately modern-day clinical trials or multimodal treatment plans in combination with new treatments available in clinical trials to examine if this feature is the quality method for you. For greater data on running with a mesothelioma specialist close to you, contact our affected person advocates these days.